Bismillahirrahmanirrahim. On behalf of Pakistan Society of Haematology, I welcome all my respected viewers to this session. It is my proud privilege to invite Professor Tahir Sultan Shamsi for this session. Professor Tahir Sultan Shamsi needs no introduction. He is pioneer of bone marrow transplant in Pakistan. He is teacher of the teachers. He is our mentor, our supervisor. We always consult him for all our difficult cases, and he's always there to welcome us. I'll invite Dr. Tahir Sultan Shamsi for this luncheon session.
Thank you very much, Raheel. Thank you very much, the audience who have joined me for this luncheon industry session. What I'm going to do in next 10-15 minutes is number one, conflict of interest disclosure. I'm going to present the data which was actually authored by Dr. Aisha Jamal, and it was published in Translational Oncology last year. And this is her data. And I must admit that the funding received for her work was from NIBD research grant. And for this particular talk, I'm receiving the honorarium from Swissmax, but the actual work which was done has got nothing to do with any industrial partner. And I must acknowledge Aisha and our transplant team, Uzma Zaidi, Saqib, and my research team who have helped to prepare this work and present this to prepare this presentation. And there's a request from Swissmec Japan if all the audience provide them feedback and scan the QR code for the survey. I'm going to show this slide again in the end. Now, important point is that for bone marrow transplant, we need to know when we collect the stem cells from the donor, because this work was done in the allogenic adult, in fact, allogenic setting. So we need to know the number of stem cells present in the product so that when these stem cells are transfused to the recipient, we get a durable engraftment and patient regenerate his marrow after receiving conditioning chemotherapy or chemoradiotherapy. And a magic figure of 2 million CD34 positive cells per kilogram of the recipient body weight is considered to be adequate for a durable engraftment when we use peripheral blood stem cells from the donor. Remember, this data is related to peripheral blood stem cell in the allogenic setting. This is not of the bone marrow harvest CD34 or HPC, which the data is going to tell you. This CD34 equivalent or a surrogate marker for CD34 is called hematopoietic progenitor cells, enumerated by flow cytometry-based Sysmex automated hematology analyzer. And this is able to segregate a distinct immature myeloid population, referred to it as hematopoietic progenitor cells. And this analyzer utilizes a refined technology of fluorescence flow cytometry for enumerating X and HPC count. The important point is that this analyzer provides us the hematopoietic precursor cell count within 90 seconds in a fully automated way. When we enumerate CD34 cells in the harvest of the peripheral blood stem cells, it takes good 2 hours or maybe more when the sample reaches the flow cytometry lab. So the idea is if we can get this HPC count within a few minutes of completing the hematopoietic stem cell collection, then perhaps you can save a lot of time, you can save a lot of money or doing flow cytometry. So this was the idea behind doing this HPC development by the manufacturer. And as I told you, this is a flow cytometry based technology. So this is we able to identify different subtype of cells based on their internal complexity, based on their DNA and RNA content, and on the size of the cell. And you are able to see different population groups in a scatter plot of WDF or WPC. So what it actually does, how does it do it? This analyzer processes the cells with a distinct reagent system. And this surfactant detergent in the reagent system lyses all the mature myeloid cells. But the immature myeloid cells, escape this lysis due to the lower cholesterol content of their cell membrane, which in other words means that the cells which fall into the category of stem cells and early progenitor cells, because of their lower cholesterol content, they survive this detergent action of this lysing reagent, surfactant lysing reagent. And then the surviving cells are counted, enumerated by this analyzer. And this is how we are able to identify the immature cells of stem cell origin, progenitor cell origin, and it gives you a number of cells present in the product. So based on this background, what we did, initially, in the phase 1 of our study, we analyzed 101 harvested peripheral blood stem cell products, and then simultaneously we analyzed this peripheral blood for CD34 cell enumeration by flow cytometry and XN HPC in XN hematology analyzer. Then we applied Spearman's rank correlation coefficient calculated for both of these parameters. Then ROC curve was computed to identify HPC value, which could optimally distinguish the cutoff of more than 2 million or more of CD34 cells per kilogram of the recipient body weight. We already know the magic number of 2 million cells, 2 million CD34 cells, is thought to be adequate and sufficient for durable engraftment. So we worked hard to identify how many HPCs should be present in the same product, which almost always tells us that the number of CD34 will be more than 2 million. So this was the basis. And then in the phase 2, when we identified that a magic number of HPC is identified, then we did a phase 2 study, which is a validation work in which HPC cutoff from phase 1, which was found to be 1.845. This validation study performed on 112 PBC products. And then we also calculated the positive and negative predictive value for this magic number. Spearman's correlation analysis showed that a value of 0.32, which was, although statistically significant, it indicated a moderately positive and statistically significant correlation between these two variables, which means CD34 count of more than 2 million is directly correlating an HPC count of 1.84. This is what it is. More than whenever the product contains more than 1.84 HPC count, this is almost always tells you that the product within the CD34 product will be more than 2 million in that particular HPC harvest. And the specificity of this 1.84 magic number is 100. And sensitivity is not that high, but it is still, I think, it is sufficiently high, around 78.2. So this study has effectively laid off the statistically significant correlation between XN HPC and CD34 cell count enumeration by flow cytometry. The high specificity of this HPC value of more than 1.84 million cells per kilogram of the recipient body weight will allow us to confidently establish the progenitor cell efficacy of any harvested peripheral blood stem cell product in the allogeneic transplant setting. However, the lower sensitivity is a significant issue, as it will mislabel a number of competent products as inadequate. Having completed this peripheral blood stem cells, then we moved on and we started to work on do we have the same cutoff of 1.84 million HPC in the bone marrow, or will we have a different cutoff? So what we did, we worked similarly on initially calculating the number of cells, HPC cells, sufficient to predict more than 2 million CD34 in the bone marrow harvest, and we were able to identify that this is not the same. So they are not interchangeable. 1.845 for the PBSC and more than 2.8 million HPC is equivalent to more than 2 million CD34 count. Then we also perform a validation study, and we were able to show that this 2.84 has been successfully validated with a positive predictive value of more than 100. So this is how we were able to show that CD34 in a resource constraint setting, or in centers who have XN hematology analyzer but who do not have direct access to flow cytometry, you can utilize this HPC count confidently, and certainly this is a very initial research parameter. Although this has been approved by FDA as a reportable parameter, but there's still not many centers are using it in the allogenic setting. So this is what is tell you that what I've told you about the validation of marrow harvest, showing 2.8 cells, always tell you more than 2 million cells of the CD34 cells in the marrow harvest. So to conclude, for all the harvested PBSC product with XN HPC value of more than 1.84 million cells per kilogram of the recipient body weight, CD34 cell enumeration by flow cytometry can safely be disposed of. This is a big statement, but I think in time to come, there is a possibility that use of HPC will be more effectively utilized by many centers. So beyond a cutoff of 2 million, it does not tell you the actual number of CD34, correlation of CD34 cell count beyond 2 million. So assuming that if you want to know that the cells are, when the HPC count tell you that the CD34 is more than 4 million, you may not be able to find a correlation there. But as a screening tool, yes, 1.84 million HPC cells are equivalent to CD34 count of more than 2 million. This is what have been found out by this study, and this has been published. What are the limitations of this study? It's a single-center study. Although this has been the data has been validated, more centers need to be done. A multi-center study need to be designed. So this is the sort of work which can be planned in future. And another important future endeavors which we want to take is we would like to identify what these HPC cells actually composed of. Apart from CD34 cells, what other immunophenotypic phenotype do these HPC cells have? So this is the future endeavor we are looking at. Thank you very much for your attention, and I'll be happy to answer any question. And I repeat the request from Sysmic Japan again. Please scan this QR code for the survey or click the survey link in the chat box. Thank you very much. Over to you, Raheel, if you want to have any questions, or any of the participants have any questions.
Sir, thank you very much for such a wonderful talk, innovative study, definitely, which has raised a lot of questions and a lot of interest as well, and very, very useful indeed for resource limited countries, especially in those setups where CD34 is not available. So, sir, I'm just waiting if there is any question. In the meantime, sir, if I can take the liberty to ask you one question. Sir, as you rightly pointed out towards the end, that the upper limit is not like we can just differentiate whether it is less than 2 or more than 2. For malignancies, malignant disorders, patients with a high, those who are at high risk of GVHD, definitely we do not want to infuse a lot of stem cells in them, and normally we try to give them a dose maybe between 2 to 3. So in those circumstances and settings, sir, what are your recommendations regarding practical use of this?
You're right. Not only in the malignancy, but also especially in benign disorder, we are more worried about GVHD. We have worked on it, and we have identified an HPC count of, but the HPC count was very high. HPC count of the cutoff was, I think, about 8 or 9 into 10 to the power 6. So, but that data has to be validated. What we suggest at the moment, that it can be utilized, because there are situations where you have to decide whether you want to have another collection the following day. So, and you can instantaneously, you can tell, okay, fair enough, we have less than 2 million, less than 1.84 HPC count. So that means the product will not have more than 2 million CD34. So let's plan another session tomorrow. So you can identify instantaneously. And CD34 count may be available later on in the evening, or maybe tomorrow or the following day. But with the help of HPC, you can plan the next collection from an allogeneic PBSC donor instantaneously. This is one utilization. Second one is, we know there are many centers doing transplants, but not every center has access to flow cytometry. They usually send it across the road, or maybe in the Twin City to get it done. So utilizing, and this hematology analyzer, I think most advanced centers in our country have a similar instrument, or the same XN20 or XN10. So they may utilize it for this particular purpose.
Sir, absolutely. Thank you very much. Another practical application which I can think straight away, is that we are standing on a BMH table and we don't know that we will be getting adequate CD34 dose or not. And with this study of yours, we can get the report in 2 to 3 minutes, and we can plan on the OT table as well, that we can harvest more stem cells at that time in order to avoid PBSC. So definitely, sir, it is a wonderful study. Yes.
Yeah. So for marrow harvest, the number is not 1.84. That is 2.8.
2.8, sir.
Yeah, this has been validated and is gone for publication. Sir. Right. So hopefully within the next few weeks, you will have another published manuscript from us.
Inshallah, sir.
Inshallah.
So thank you so very much, sir. It was an honor and pleasure as always to have you with us, sir.
Thank you. Thank you.
Thank you very much, sir.